So for introduction, my study focuses on financial risk management, examining the impact of internal and external factors on the financial risk of CVS Health Corporations from 2015 to 2024, with return on asset ROE as the dependent variable. The key issues include high leverage, declining liquidity, fluctuating profitability, and operational inefficiency, which increase financial risk. The study hypothesized that firm-specific internal factors have a stronger influence on ROE than macroeconomic factors. The research objective are to analyze the impact of internal factors, macroeconomic factors, and their combined effect on ROE. Accordingly, the research questions examine whether these factors significantly affect CVS financial risk measurement by ROE. There are three research objectives. First, to examine the impact of specific internal factors on financial risk. Second, to examine the impact of macroeconomic factors on financial risk. And lastly, to examine the combined effect of internal and external factors on financial risk. For literature review, this topic is derived from prior studies that identify ROE as the key indicator of financial performance and financial risk. Past research shows that ROE is influenced mainly by profitability, leverage, liquidity, and operational efficiency. Credit risk literature highlights that high debt to equity ratios reduce ROA, while liquidity risk studies shows that weak current and cash ratios increase financial vulnerability. Operational risk studies emphasize that unstable operating margins negatively affect ROA. Meanwhile, macroeconomic variables such as GDP growth and inflation are often found to have weaker direct effects, justifying their role as external control variables on this study. So for the methodology, this study used CVS Health Corporation as the sample with 10 years of annual data from 2015 to 2024. The analysis applied ordinary least square OLS multiply linear regression using SPSS. Three regression models were developed. Model 1 examined firm-specific internal factors. Model 2 focuses on macroeconomic factors. And lastly, Model 3 analyzed liquidity and operational efficiency factors. Descriptive statistic, correlation analysis, ANOVA, and regression coefficient were used to evaluate how this variable influence ROA as the dependent variable. The descriptive statistic shows that CBS Corporation has moderate asset profitability with an average ROA of 3.45%, but faces high financial risk due to leverage and weak liquidity. The debt to equity ratio of 2.06 indicates heavy reliance on debt, while the current ratio of 0.98 and cash ratio of 0.11 reflect limited short-term liquidity. Operational indicators suggest relative stable cost control but inconsistent profitability. Overall, the result indicate that internal factors conditions are the main contributors to ROA volatility. Correlation result shows a strong positive relationship between ROA and ROE, R equal to 0.975, indicating that higher profitability improve asset performance. ROE also has a strong negative relationship with debt to equity, R equal to negative 0.852, showing that higher leverage increases financial risk and reduce ROA. The relationship between ROE and macroeconomic variables such as inflation and GDP growth is weak and not significant, confirming that internal firm specific factors have a great influence on ROA than external factors. The ANOVA test evaluates whether the regression model is statistically significant as a whole. The result shows an F value of 22.985 with a P value of 0.160, indicating that the model is not statistically significant as the 5% level. This suggests that although some variable individual influence ROA, the combined effect of all independent variables does not strongly explain variations in ROA. This outcome may be due to the small sample size, high volatility in financial. The regression coefficient result shows how each independent variable individuals affect ROE. Return on equity ROE has a positive coefficient in 0.389 and is the most influential variable, indicating that increase in profitability significantly improve asset returns. Other variables such as liquidity ratio, dividend payout ratio, inflation, GDP growth, and unemployment rate are statistically insignificant, suggesting that they have minimal direct impact on ROA. The negative coefficient on leverage-related variables imply that higher debt increased financial risk and weakened ROE. Overall, the coefficient result confirmed that profitability and capital structures are the key derive of financial risk on ROE. Model 1 shows an extremely strong explanatory power with an adjustment R squared of 0.996, meaning that 99.6% of the variation in ROA is explained by internal firm-specific factors such as profitability, leverage, and operational efficiency. The high R value confirms a strong relationship between the predictors and ROA. This model is the most powerful among the three, clearly indicating that internal financial management plays the dominant role in determining ROA. So for model summary 2, focuses on macroeconomic variables and shows a much weaker explanatory power with an adjustment R square of negative 0.025. This negative value indicates that macroeconomic factors such as inflation, GDP growth, and unemployment rate do not effectively explain changes in ROA. The higher standard error further suggests lower prediction accuracy. And then for model model 3 examined liquidity and operational efficiency variables and record an adjustment R squared of negative 0.079, indicating very weak explanatory power after adjustment. This suggests that liquidity and operational factors alone are insufficient to explain ROA variations without considering profitability and leverage. In conclusion, the study finds that CPS Health Corporation's financial risk measured by ROA is mainly driven by internal firm-specific factors rather than macroeconomic conditions. High leverage, weak liquidity, and unstable operating performance increase financial risk. Therefore, CPS should reduce excessive debt, strengthen liquidity management, and improve operational efficiency to stabilize ROA. Continuous monitoring of internal financial indicators is recommended to enhance long-term financial stability.